Today is World No Tobacco Day, and the World Health Organization emphasized how tobacco, in addition to being a health risk, also harms the environment and is a massive contributor to climate change. According to the organization, some 4.5 trillion butts are wrongfully discharged into the environment every year. Now, let's discuss this. We're now joined via Zoom by Lorraine Govender, National Health Promotions Manager for CANSA. Lorraine, thank you so much for your time this afternoon.
Good afternoon to you and the viewers. Thank you for having the CANSA Association.
Now, of course, this conversation is going to take us from a health perspective and the health side. You know, this has been an ongoing fight that spans several years. Have the controls that have been put in South Africa to at least curb the use of tobacco worked? Are you seeing some improvement over the years?
Yes, we did make a steadfast headway in terms of our tobacco control legislation. And for many years, South Africa was one of the leaders in Africa. But over the last, should I say 10 years ago, we've been lacking as a nation in terms of, promulgating new legislation to protect the public. So this is why we are actually pushing for the new bill to be passed by Parliament to help protect our nation.
Let's talk about this bill. What exactly are you hoping will happen once it is passed?
So once it will be passed, we're hoping, I'm sure many of you know, and you yourself have seen the widespread, almost like a wildfire, vaping. Vaping has taken on a new perspective internationally throughout the world, and we're seeing that in South Africa as well. So our huge appeal right now is to ensure that e-cigarettes is controlled in the same way as other tobacco products, because currently it is not being controlled like other products. And we're hoping that, one of the other big things in the law is 100% smoke-free indoor areas, plain packaging, pictorial or warnings, banning adverts at tills and in retail outlets, and also the sale of tobacco and related products in vending machines. So if you think about smoke-free, 100% smoke-free indoor areas, and you think about the people that are being exposed to secondhand smoke and the harms related to that, we really want to push for this bill. I've just come back from one of the universities and interviewing some of the youth there. Almost every other third person was using e-cigarettes. And when I asked them, so why are you using this? It's like, it's cool. Everyone's doing it. It seems like fun.
And it is quite concerning.
But now, often they don't know that e-cigarettes are...
Just talking about e-cigarettes, and I'm glad you mentioned it. I mean, as you also say, just coming from that university, you see also much younger children taking up on e-cigarette because not a lot is known about their safety. So talk to us. What do we know about just, what the impact of e-cigarette smoking is?
Well, if we think about e-cigarettes, it has it's an electronic delivery system, and most of it contains nicotine. And often people, the youth, they're so trendy, and they want to keep in with the peers and identify with the rest of the group, and they use it, and they don't realize they're actually getting addicted, because nicotine is an addictive substance. And I spoke to one of the youth today, and she was in her early 20s, and she's already complaining of having chest problems, and she told me that she's hypertensive. At that age, it's unbelievable. So the problem is, because youth are being enticed by the tobacco industry, and it's just the tobacco industry is creating another generation of addicts, and our youth are being influenced by that because they often don't know the harms of it. So I think educating people more on the harms of e-cigarettes will help us in the long run.
Now, just as a CANSA representative, I mean, you've worked extensively on seeing just what the impact on tobacco is on some of your patients. then we've seen, of course, the controls that we talked about a little bit earlier on, just to try and prevent people from taking on smoking, those that have not and those that have for years, which is also, of course, a very addictive habit, as you've said, find it very difficult to leave it. Does putting warning signs on cigarette packets actually work, especially for those that have not started smoking as yet?
So research and evidence shows that, a lot of the people that are using tobacco products often don't realize the harm, in terms of it. And I'm so glad that you touched on something. We at the Cancer Association, we have care homes throughout our country, and we see patients daily, see the harms. Tobacco causes over 16 different types of cancers. So just seeing that devastation alone, it's quite a concern for us. And often when you use the product, you don't realize long-term what effect it's going to have on you. So I believe strongly that, people need more education. And if you are smoking, if you think about it, although 1 billion people worldwide smoke, a lot of them smoke, a lot of people have actually quit. And it's not difficult. The immediate stop that you make, almost the next day, you're going to feel the difference. You're going to feel healthy. So cessation is not something that's impossible. You can absolutely get down to it. Our concern with e-cigarettes, I want to bring that back in, is, one of the youth mentioned how costly. He said to me, it cost me like 200 Rand a month just for the e-cigarettes. So when they don't have the money for e-cigarettes, they're going to go to cigarettes. And so this e-cigarettes is definitely going to cause a dual addiction. And the youth are going to eventually go back to cigarettes because of being addicted to nicotine.
So on a day like this, what are then the practical steps to take, to not only, bring awareness, but also to make sure that, those people that are taking those e-cigarettes, as an example, stop and do it as quickly as possible before it becomes a habit and forces them, due to financial reasons, to go into smoking tobacco?
Yeah, I think, when we think about it, we strongly believe, and this is why, a lot of our members in the Tobacco Control Alliance in South Africa are fighting for the bill to be passed. Everywhere you go, every corner you take, there are vape products so easily available, little control. So once the legislation is passed, then the e-cigarettes will be controlled in the same manner as tobacco products. So that alone will be a deterrent because it's so readily available. Often people don't think, hey, you know what, this can be harmful to me. And when I spoke to the youth, I realized that's what they think. They're unaware how dangerous and unsafe it is. So definitely the more education and awareness, parents as well, please don't use it. Don't expose your children to it. Don't buy it for your children. And if there's more control and legislation to control e-cigarettes, it will definitely stop people from using it.
And of course, people to enforce that legislation once it is passed. Lorraine, thank you so much for your time this afternoon. Lorraine Govender, National Health Promotions Manager for CANSA. Thank you so much.